Well, hi there, everybody. This is Mark Idelman, speech language pathologist, and welcome to the teaching of talking. This little video is going to be about a subject called global aphasia. Global aphasia. Now, I don't know about you, but when I think of a globe, I think of a big round circle, and in that globe is every country, every city, every body of water, every ocean. Um, and so when a person states that they have global aphasia, usually pretty much what they're saying is the fact that they probably have an apraxia, which is difficulty moving the tongue or difficulty imitating speech sounds. And so an apraxia is a motor problem, and the motor just doesn't work very well for the tongue and the teeth and the lips to say the sounds that are necessary in order to speak. All right, so that's an apraxia, all right? Now, then there is something called an aphasia. An aphasia is a language difficulty, and there are many different kinds of aphasias. And I'm not going to get into all of them right now, but one of the major ones is called a Broca's aphasia. Broca, B-R-O-C-A apostrophe S. Broca's aphasia. And what Broca's aphasia is a failure to imitate speech. It's the difficulty of having a thought in your mind and being able to express it to another person. So if somebody asked me if I wanted a glass of water, and if I knew I wanted a glass of water, but if I couldn't initiate it, means that I couldn't come up with the words in the right order and say the words and do it voluntarily. Okay, that's called a Broca's aphasia. And it's the same thing if you're in the supermarket or you're somewhere and you see a neighbor or an old friend and you want to talk with them, but you can't remember their name. Or maybe you can remember their name, but it's on the tip of your tongue, so you say, on the tip of your tongue, but it's not there, okay? And that's what a Broca's aphasia is like. It's about having something you want to say, and the words that you need in order to express yourself are just not there. And so that's a Broca's aphasia. And then there's a Wernicke's aphasia, and that's where the person speaks gibberish. And they think that if only you would listen, you would be able to understand what they say. But a Wernicke's aphasia is like a jargon aphasia. And a jargon is a person's own language, okay? It's made up language. And it's made up of sounds and things that sound like words, but when you try and understand what those words are, guess what? They aren't there. You can't understand what they're saying because it's all gibberish. And that's what we call a Wernicke or a Wernicke's aphasia. All right, so where am I going with this? Okay, so where I'm going is that the fact that if somebody tells you that your loved one has a global aphasia, chances are you need to know that they probably have an apraxia, which is difficulty moving their lips and their tongue and their throat to make the sounds. And then they probably have, but not in all cases, because sometimes the apraxia can be so bad a person can't say what they want to say. So sometimes it's difficult to determine if a person has an aphasia or how severe the aphasia is if the sounds of speech are not accurate or not produced, correctly. Now, the other thing that some people say is there's expressive language. Now, when we express our language, we do it pretty much in two ways. We either speak or we write. That's called expressive language. Now, usually with a stroke and aphasia, there is diminished expressive aphasia, not only in speech, but also in written communication, in the ability to write, in the ability to write words. Now, there are some people who have aphasia who can write the words that they want to say, and sometimes they can even read those words. So there's also another kind of aphasia, and that's called a mixed aphasia, without trying to get too complicated, because I don't want to get complicated by this. But what a mixed aphasia is there's a little bit of everything. There's a little bit of possibly Broca's aphasia, but they may be able to say some words, and they might be able to articulate some words and say some words. So they may have a mild apraxia or a severe apraxia or a profound apraxia. So this big gigantic word global aphasia is what we were always taught as students as something called a wastebasket word, a wastebasket diagnosis. And what that typically means is that you give something a diagnosis that's kind of general and non-specific. And that's why when somebody says a global aphasia, it's not really telling you anything. It's not really telling you anything, because also sometimes a global aphasia can be difficulty of the person to understand what's being said to them. And at other times, if they go to look or read, they have difficulty with reading. So global aphasia affects many different areas of communication. And remember, it's a wastebasket word. If you really want to know what's going on with your loved one, if your loved one has had a stroke or aphasia, you kind of want to find out about whether there's an apraxia, how much of an apraxia there is there an aphasia, what kind of aphasia is it? Is it like a Broca's aphasia? Is it a mixed aphasia? Okay, is it a Wernicke's aphasia where there's just a whole lot of gibberish coming out? So you want to know if they can read, you want to know if they can write, you want to know specifics. If somebody throwing around a term like global aphasia is really not fair, because most people don't know what it is, and most spouses or family members don't know what it is. So one of the things a good speech pathologist will do will explain exactly what's going on with speech and exactly what needs to go on with the therapy and what needs to be addressed to help the person communicate better. So that's just a little Just a little review of what I would consider to be a very important subject that many people are said to be diagnosed with, but remember, it's a wastebasket term, it's nonspecific, and if you want to know what's really going on with your person, you need to speak to really a speech pathology expert, because a lot of the doctors, they're really good in diagnosis of medical conditions and treatment of medical conditions, but they don't always know a whole lot about speech and language and the evaluation of speech and language, how to determine the prognosis for speech and language, how to determine the frequency of speech and language. So, the best thing always is that if you have a particular problem, go to the person who is the expert in that particular area. All right? Because if you try to go to somebody else and have them advise you about something that they're not really expert in, you're going to get an opinion that may not be accurate. Okay? Or you might get an opinion that may be expedient, which means you'll get an opinion that, just says, well, we don't think there's going to anything that can be done. They have global aphasia, and the chances are he'll never talk again. And there are so many people out there who do that, and that's what I would call a crying shame. So this is Mark Ittleman explaining to you today about global aphasia. And if you do have global aphasia, find yourself an expert, learn about it, have that expert teach you what you can do at home. And below this video are a bunch of links which can take you to our Facebook page or our YouTube page. Well, you're already on the YouTube page, or to our website, or to Twitter, or anything like that, because I put up a lot of videos about aphasia, apraxia, dysarthria, and if you are a loved one or a family member, you need to learn as much as you can. You need to get a multitude of opinions. Find out what opinion resonates best with you, and then kind of pursue that. And so those would be my recommendations for you today. So this is Mark Ittleman, speech-language pathologist. If you've liked this video, please give us a thumbs up. Underneath that is an area that says subscribe. And underneath the title of this video about global aphasia are the links that you can find out more about us and what we do to help you, because we train you. We train you to be as good, if not better, than anybody else out there when it comes to helping your person talk, whether they have aphasia or apraxia or whatever they have. So my name is Mark Ittleman. Contact information is down below. I hope you've learned from this little video, and I hope that you have a great day today, a good week, a good month, a good year, and of course, a wonderful lifetime. Bye-bye now.